Hey, what's up?
What's juvenile onset diabetes?
Oh, so juvenile onset diabetes is also known as type 1 diabetes, and this happens when your pancreas is producing no insulin. Now, it's important to understand that you have type 1 and you have type 2 diabetes, right? And type 1 diabetes is an autoimmune issue where your body's immune system, for some reason, starts destroying the cells that produce your insulin. In your pancreas, you have your islets of Langerhans, your islets of Langerhans, which is a cluster of cells. You have alpha and you have beta cells. And your alpha cells release glucagon and your beta cells release insulin. Now, glucagon increases blood sugar levels and insulin lowers blood sugar levels. And so you have that. So juvenile onset diabetes is type 1. And then type 2 diabetes is normally considered not later onset, but adult diabetes. Now, one thing that students should understand is that today, because of the US diet, you have scenarios where you have young kids developing type 2. So don't focus as much as you would on the age. Focus on the insulin production when it comes to the disorder. So if you have juvenile onset diabetes, it's most likely type 1 diabetes. However, you want to ensure that it's type 1 versus type 2, because if they say type 2, that's 100% juvenile onset diabetes. There's no insulin being produced. But if you have type 2 diabetes, there's some, and that's going to be a little bit different. So let's focus on juvenile onset diabetes. So in type 1 or juvenile onset diabetes, you have no insulin being produced. And this presents a unique problem because the patient becomes 100% dependent upon food to increase blood sugar levels, and they rely 100% on insulin injections to lower the blood sugar levels. So these patients are at higher risk for unstable glucose levels if they're not careful. These patients will be on a carbohydrate count where the carbs equal a certain amount of points. And there's a ratio that the doctor will set for every given patient, that for every gram of carbohydrates you consume, you're going to have to replace a certain amount of insulin units. So you're going to be doing the sliding scale, meaning you check the glucose level, whatever the sugar is, you have to give a certain amount of insulin. On top of that, you have to do a correction with the carbohydrate count, because if the patient's going to consume X amount of carbohydrates, well, then we must give them an X amount of insulin units as well to make sure that we lower the blood sugar to the normal level. Now, one thing about type 1 diabetes or juvenile onset diabetes is that, remember, it's an autoimmune issue. It happens early on in life. You're completely dependent on food to increase blood sugar levels. You're completely dependent on insulin injections to lower it. And these patients, you have to be very careful, because you know how exercise lowers blood sugar levels? Well, if these patients are going out on exercise to do some exercise, and they start working out, well, that's going to lower blood sugar levels, because the muscle metabolism also lowers blood sugar levels without the utilization of insulin. And so they must carry some type of hard candy or a fast-acting glucose to ensure that once they feel the signs and symptoms of hypoglycemia, something like tremors, shakiness, they'll have like tachycardia, cold clammy skin, any nervousness, any indications of sympathomimetic action, which usually indicates hypoglycemia. That is what the patient's going to feel during the onset of hypoglycemia. And they should consume a fast-acting carbohydrate, and then they should take a more complex carbohydrate to maintain those glucose levels. So remember that when you have hypoglycemia, you must give a fast-acting a fast-acting carbohydrate first, and then give a complex carbohydrate to make sure that you maintain that glucose levels, and so they don't go too low. And that's pretty much what juvenile onset or type 1 diabetes is.
Thank you.